Welcome to the Johns Hopkins University Virtual GIS Week. You are currently in the session of Mapping Industrial Food Animal Production, and we are so glad that you're here and excited for our panels of experts this afternoon. I'm Deanne Williams. I'm a Senior Program Officer from the Center of a Livable Future at the Bloomberg School of Public Health. And first, I'd like to introduce our co-sponsors for GIS Week. It's sponsored by the Johns Hopkins Center for a Livable Future, an academic research center focused on the intersection of public health, the environment and food system, and the Johns Hopkins Spatial Science for Public Health Center, an academic research center focused on the development and application of spatial analysis, GIS, and spatial statistics for public health research. So before I introduce the panelists, I'd like to go over a few housekeeping notes. We will be recording the second half of this webinar and we'll make it available after our sessions are complete. Please post questions for the speakers in the Q&A box below, and we'll have time for one question after each speaker after the presentation. Daniel will be leaving our session early, so we may have a few questions for him after his session. And then we'll also have an open question and answer period at the end of the webinar. So I'd like to introduce the speakers for our session this afternoon. So talking about deep learning and spatial identification of animal production facilities, we have Daniel Ho. He's the William Benjamin Scott and Luna M. Scott Professor of Law at the Stanford Law School, Professor of Political Science, Senior Fellow at the Stanford Institute for Economic Policy Research, Associate Director of the Stanford Institute for Human-Centered Artificial Intelligence, and Director of the Regulation, Evaluation, and Governance Lab, the Reg Lab. He received his JD from the Yale Law School and his PhD in Political Science from Harvard University. Our second presenter on mapping the food system is Leah Douglas. Leah is a staff writer and associate editor at the Food and Environmental Reporting Network, an independent nonprofit newsroom that publishes investigative and explanatory reporting on food, agricultural, and environmental health. Leah's reporting on corporate power and big business in the food and agricultural sectors has been published in The Guardian, The Nation, The Washington Post, Mother Jones, NPR, and many other outlets. Leah's work has been cited in dozens of print and television media outlets, including the New York Times, Washington Post, AP, and The Atlantic. Leah was the 2020 recipient of the National Farmers Union Milt Hackle Award for Excellence in Agricultural Reporting. Our third and final presentation on geography and shifting to plant-based diets is Brent Kim. Brent earned his master's in global disease epidemiology from Johns Hopkins Bloomberg School of Public Health, where he now serves as a researcher at the Center for a Livable Future. Since joining the center in 2008, his work has spanned farm to fork with published works on sustainable diets, climate change, industrial food animal production, food and agricultural policy, soil safety, and urban food systems. His work has been featured in Popular Science, The Guardian, The Huffington Post, NPR, and Newsweek. So we're excited to hear about your work. And Daniel, please share your screen and unmute yourself.
Okay, so thanks so much for having me. This is, it's really exciting to be here, and thanks Daniel for that awesome presentation. I know as a journalist, the work you're doing, it's so essential. It'll be so great to have those resources as somebody who's covered CAFOs for a long time. The lack of information about where the facilities are is, you know, a major obstacle. So that's really exciting to see that work's underway. So I'm going to talk for a few minutes about the project I'm working on right now, which is mapping the spread of COVID-19 in food system facilities across the country. And this project has been underway for about 7 months and is ongoing. And for just some broad context, essentially, this project emerged out of some early coverage that we were doing at Fern of the pandemic, and noticing what has now become quite a well-covered story about how food system workers were being uniquely exposed to the virus in their workplaces. And so I'm going to walk through sort of how this project originated and where we're at with it now. So this is the first version of the map that I published on April 22nd. And at the time when I first started working on this project, Fern, when the pandemic began, like every newsroom, reallocated our resources immediately to covering the pandemic and its impact on our, corner of the universe, which is food systems and agriculture. And at the time, a lot of the emphasis was on disruptions in the supply chain that were, a lot of folks were concerned about food shortages being a really, high possibility at the time. And that issue was being caused in part by absence of workers at food processing facilities. Why were workers absent? Well, COVID-19 outbreaks were hitting meat and food processing facilities really hard in the first few weeks and months of the pandemic. So I was covering a variety of topics around that time and started noticing these reports popping up of different, mostly large meatpacking plants that at the time were experiencing pretty significant outbreaks of COVID-19. And I sort of was wondering, is this going to be a story? Is there a trend story to write here? Of course, looking back, it seems naive, but at the time, we had no idea where the pandemic was headed. And so I started aggregating some news reports about the spread of the virus at these facilities to try to draw out what I thought might be one story with one map about, here's how the pandemic affected, past tense, food system workers. So after gathering that data for a couple of weeks, I published this initial map using a software called Cardo. And you can see that at the time, there were very few outbreaks compared to now. I think there were about 40 in the data set at the time, and they were just meat packing facilities, which, essentially slaughterhouses where whole animals are brought and processed, and food processing facilities, which I've sort of categorized as everything from sort of next stage meat processing, so places that make salami and sausage, to all the factories and facilities that process our fruit and our produce, frozen food, prepared food. There are thousands of these facilities across the country, and we're starting to see outbreaks there as well. So those are the two categories that I was initially mapping back in April. A few months later, the pandemic had obviously expanded significantly. And at this stage, I think I had about 400 outbreaks on this map. And I had also started seeing reports of outbreaks at farms and ranches. So added a new category for understanding how the virus was spreading among workers at the facilities where food is produced initially before it goes into processing. And it started to emerge, some pretty clear patterns in the map. There was a high density of outbreaks in the meatpacking sector in the Midwest, where there is the highest number of beef and pork facilities. And there were also some regional clusters emerging, whether in the Central Valley in California or the Pacific Northwest, where there's a lot of produce and fruit production and processing. And this map sort of started to sketch out, unfortunately, and quite morbidly, sort of a map of regional, food production in the US. And so this is the newest version of the map. This is from yesterday, a few bubbles short, but more or less how it looks now. And I shifted it over the summer in terms of how the data was being visualized, just to try to more accurately demonstrate where the largest outbreaks were and where the highest number of smaller outbreaks were, because there's some new learnings that we can take from the data when it's distributed this way. First of all, we can see that by and large, the largest outbreaks have occurred in the Midwest in those really large beef and pork packing facilities. And we can also see that there's a high number of small clusters in places like Arkansas, Southern California, still in the Pacific Northwest, the upper Midwest, Wisconsin, Michigan, Illinois, where there are high density of these smaller food processing facilities and also farms. So the data set as of today has over 1,200 outbreaks in it, and that's the most comprehensive number we have on how many food system facilities have been affected by COVID. That not all of those 1,200 are mapped because of not all states are releasing data on outbreak locations, which I'm going to talk about in a minute. So this is a chart just showing, how the number of cases among workers has risen over time, and get those numbers in there. So This shows some interesting patterns in terms of the data. You know, we saw this really steep rise throughout the spring and early summer and new cases, and to some extent, the number of new cases has leveled off with some you know, upticks here and there. Of course, it's still growing. You know, approaching 74,000 workers that have contracted COVID across these three sectors. Meatpacking accounts for the largest share, and also I think is the most accurate tally in terms of how many workers in that sector have been sickened by COVID, in part because you know, the media and, you know, public attention emphasis on meatpacking has been so strong for so many months. There's been a lot of information available compared to the other sectors for how workers have been affected. So, but we're still seeing cases tick up despite some leveling off, and actually in the past couple of weeks, kind of a worrying, you know, new kind of angle for the way those cases are going. And these sort of bubble charts demonstrate, you know, how many workers have been sickened and also have died by company. So, you know, it's just another way to help readers understand, you know, this all this data and try to draw out different learnings. So we can see that Tyson Foods is by far the largest. Well, the workers at Tyson Foods have been most affected by the virus, I should say. So over 11,000 cases of worker illness and 35 deaths at least. And there's, you know, in the live version of these little maps, when you hover over each of these bubbles, it will tell you, you know, which company and so on. But we can see that other major meat packers, JBS, Smithfield, Cargill, have also had a high number of worker deaths, and also companies like Foster Farms, National Beef, Triumph Foods that are comparatively smaller players in the industry, but have been sort of disproportionately affected by the spread of the virus. So using the data that I collected for this mapping project, I've been, you know, sort of layering on top as many analyses as I can to try to understand, you know, what can we learn from how the, you know, virus has spread over time. And this chart I made for a story I did recently in October, so it's not fully up to date, just trying to see, you know, when we saw the highest number of new cases. So pretty clear that, you know, in the spring, we did see the highest number of new cases. Farm work became a higher share of the total as the summer months went on, and there were more migrant workers in the US, more H-2A workers. And we did see something of an uptick in September. And so that, you know, raised some alarms about a potential continuing surge in cases into the fall months, which I'll revisit at the end. This was just to give a sense for the share of the sector that's been affected. So, you know, these are very conservative estimates. You know, I'm really careful not to overstate the effect that the virus has had. So it sort of has the effect of likely understating it. But just according to the data that I've collected and estimates by the CDC, that there are about 525,000 frontline meatpacking plant workers in the country. It's over 9% of the entire workforce has contracted COVID-19. And I tried to make sense of, you know, Tyson Foods, you know, has the largest share of cases. It's also the largest employer in the sector. So, you know, a lot of folks asked me early on, you know, does that explain their high number of cases? We can see here that is also disproportionate. You know, it's a higher share of Tyson workers that have gotten sick as compared to Smithfield or JBS or other companies as well. And it's well known that, you know, the vast majority of frontline food system workers in all sectors are people of color. A CDC report found that about 83% of meatpacking plant workers who contracted COVID were people of color, which is disproportionate to, I think, the share of the overall workforce is in meatpacking is, I think, closer to maybe 50%. So that is a disproportionate impact as well. So just to speak briefly to some of the underlying data issues that I referred to. So, you know, this project has relied on me hand collecting all the data that's in the data set. This is not information that's being collected by the federal government or by any nonprofit or other, you know, information source. I have been culling and going through news reports and public records and state data for 7 months to build this data set. And along the way, I have encountered, you know, quite a number of obstacles in terms of trying to understand, trying to get the best data possible, essentially. So one of the first obstacles that emerged was that meatpacking companies have been, and really all companies in private industry have been really reticent to share information about how many of their workers are sick. And this in July, I wrote a story that I could have written sort of at 3 or 4 different points in this 7-month process, but where it had appeared at the time that new infections among workers had slowed. But I was making the point here that we also had very poor information from many of the companies about how many workers were testing positive in their efforts to test their workers to the extent that they had them at the time. So that remains an obstacle. These companies have actually gotten even less transparent over the course of the pandemic in terms of how many of their workers are sick and what their specific testing practices are. Unfortunately, another barrier has been that public health departments have also not provided as rigorous and transparent data as would be needed to really understand the full breadth of this crisis. So, I did a story in August looking at, if I emailed every state in the country, who would hand over data looking at, how many outbreaks have there been in food system facilities, where specifically are those outbreaks located, what's the name of the facility, and so on. And I found that just 4 states have data reporting practices. Either they do their own regular reporting on a weekly basis, or they were willing to share information that met the recommendation of public health experts in terms of what information states should be sharing on a public dashboard about workplace outbreaks. And the lighter shade colors on the map show there was some variety, some partial information shared. Some states simply don't collect this data, which is even more worrying. And all the grayed out states just declined to respond to the requests. So since this story, I've also moved into public records requests, which is another way to get at that information, but it's a quite lengthy process and by no means comprehensive in and of itself. So another, issue with the data is state policy around how this information should be shared. So as I said, there's been a lot of public pressure on the meatpacking industry in particular to be more transparent about, worker protections, to be more transparent about outbreaks at their facilities. And in some states, there was some moderate measures taken over the summer to try to meet that public demand and the demand from media for more information. To introduce more rigorous reporting of COVID-19 outbreaks. Unfortunately, within just a week or two, in many cases, the business industry pressure was so, the backlash was so severe that several of those efforts were then rolled back. So in particular, that's looking at, a state like Kansas, for example, that had made a decision to start publishing specific names of facilities that had COVID-19 outbreaks and cumulative numbers of cases throughout the pandemic. That information was up for 1 week and then it was taken down and sort of reshaped into a form that there is more information being reported by the state now than there was, but there's not, the way they're reporting it doesn't really allow you to understand specifically which facilities have had outbreaks and how many cases there have been since the start of the pandemic. So it makes it quite difficult as a reporter to try to understand, what's the cumulative impact of this pandemic on workers in this state. It really stays sort of an open question. And just to sort of wrap up on what we're looking at in the next few months, I did a story a few weeks ago talking about as we're looking at cases surge nationally each day, what does that mean for the food system? Meatpacking companies and food processing companies have been really vocal about the steps that they have taken to protect workers. More access to PPE, more access to paid time off, and so on. There's potentially some data that supports that, those efforts have helped to slow the spread of the virus to some extent. However, the data does not support that the virus is no longer spreading in these facilities. In fact, yesterday I ran some numbers and found that over 400 meatpacking workers across the country have contracted COVID just in the past 2 weeks. So that's a pretty high number, and that's only drawing on data that I have from 4 or 5 states because, again, the access to information is so limited. So, over the next coming months will really be a test to see, what has the industry learned from that, initial horrible outbreaks in the spring, and what's being applied and how will the wildfire spread as we're confronting this, really huge challenge of the cases rising nationally to unprecedented levels. All right, that's all I got, and I look forward to any questions.
Great, Leah. Thank you so much for that. And I can't thank you enough for the work that you've done. I know that, we've used it a lot in some of the presentations that we've given. And my first question is, just how in the world did you get this data?
Great question. So, as I said, I collect the data by hand. So what that means is that early on in the pandemic, it looked like reading, just dozens of news articles a day, mostly from local newspapers, and pulling out, where there were breaking news reports of new outbreaks coming out all the time. And there was some initial state reporting from health departments or county health departments on, outbreaks among food system workers. Over the course of the last several months, the level of the crisis of the pandemic has really escalated, and there's been, of course, many other crises going on in the nation to cover. The slew of kind of media reports has slowed somewhat, and now the majority of the data I get is from states or county health departments. Somebody asked, is there a FOIA option? I am involved and have personally filed, in collaboration with other reporters, filed their requests. So there's some information coming in that way. But it is simply me sitting at my computer and just poring over the numbers and plugging it into my very elaborate Google spreadsheets. Yeah,
no, and I think that the big thing is, as you said before, the industry has kind of clamped down on how much they're reporting, and at the same time, based on OSHA guidelines or guidance, they are not required to report an illness unless they really think that had been contracted within the plant. So I know that has also been a huge impediment to getting a lot of data.
Yep, and that really varies state by state as well. When I learned that in the course of reporting that story on which states were releasing the information, that many states just did not mandate reporting from private industry to the local health authority that there was an outbreak, or that perhaps the local health authority collected that information but it was never relayed to the state. It's really quite disturbing and alarming to learn that even at the state level, there's not necessarily a comprehensive understanding inside the public health authority where these outbreaks are and how many workers have been sick. And so really varies state to state in terms of whether that's mandated reporting or not. And as you said, there's no federal mandate for that reporting either. The CDC information that they've been able to gather from states about this sector has all been voluntary reporting.
Yeah, well, thanks so much for your information, and thank you for your presentation. So we're going to move on to Brent now. Brent, can you share your screen and unmute yourself?
Hi, everyone. Wow, thank you, Daniel and Leah, for those fantastic presentations. Your work is so important and also sobering. It raises some really difficult questions about where our food system is headed and also where we would like it to go. So I'm going to throw another wrinkle into the mix and talk about livestock's role in climate change and sustainable diets. So climate change, all of us here probably recognize it as easily one of the greatest public health, ecological, and economic crises of both current and future generations. And agriculture, and livestock in particular, are major drivers of the greenhouse gas emissions that contribute to climate change. So globally, the livestock sector is responsible for an estimated 15% of global human-caused greenhouse gas emissions, and that's more than the global transportation sector. And if we zoom in and take a closer look at where those greenhouse gas emissions from livestock are coming from, about 40% are methane emissions from enteric fermentation or cattle belching. About a quarter are methane and nitrous oxide emissions from the anaerobic decomposition of manure. And of course, we saw some of those, an aerial shot of some of those manure lagoons from Daniel's work. And here's a photo in the bottom left of a manure lagoon or storage pit where it's stored as a slurry from a hog facility in North Carolina.
Sorry to
Hey,
interrupt.
Brent?
I think we're not seeing your slides.
Yeah,
Oh my
I'm
gosh.
sorry.
I am so sorry. You know
I
what?
thought it was just me. I apologize.
Oh, okay. No worries. That's totally on me. I forgot to share my screen. Okay.
Thanks, Brent.
All right, you didn't miss anything too exciting. So here's some grim pictures of climate change. Here's my title slide. And this was that pie. Thank you so much for letting me know. This is the pie chart showing the global anthropogenic or human-caused greenhouse gas emissions by economic sector. You can see the livestock here is about 15%, slightly larger than the transportation slice of the pie. And then we zoomed in, and here we're doing a breakdown of where livestock's greenhouse gas emissions come from, about 40% from cattle belching, about a quarter nitrous oxide and methane from decomposing manure, another quarter from feed crops, and a smaller but not insignificant share from deforestation depicted in the bottom right, predominantly for grazing lands, but also for feed crop production as well. So important to note that when we're talking about climate change, we often think of carbon dioxide, but in the context of the food system, it's really these three major gases: carbon dioxide, methane, and nitrous oxide, the latter two predominantly from livestock production. So the Paris Climate Agreement, the goal is to keep average global temperature rise well below 2 degrees Celsius relative to the pre-industrial era. That's the emissions threshold that we need to stay below in order to avoid the most catastrophic climate change outcomes. So ideally well below 2 degrees Celsius. Ideally, we would keep it at or below 1.5 degrees Celsius. That's what we're really aiming for. So if we take a look at agriculture's role in these climate mitigation targets, this is from a report we put out in 2015, but it's still relevant now. On the left-hand side, you can see agriculture's contributions to global greenhouse gas emissions, measured in gigatons of carbon dioxide equivalents per year in 2010. And above that, we see non-food emissions from sectors like industry, transportation, and energy. Over to the right-hand side, we can see the projected contributions of agriculture to greenhouse gas emissions under a business as usual scenario. That is a scenario in which global meat and dairy intake continues to rise as projected by the FAO. The challenge is that those projected emissions from agriculture in 2050 fall barely just short of the threshold for all sectors that we need to stay below in order to have a 2/3 chance at staying below 2 degrees Celsius. Now, of course, the problem is that this threshold is not just for agriculture, that's the target for everything. So if agriculture eats up this much of the budget, there is little or no room for the emissions from all the other sectors. So we could be wildly successful in converting to renewable energy, but there's still no way that all sectors combined are going to stay below this threshold. So yes, we have to address the emissions from energy and transportation, but we also have to shrink the emissions from agriculture in order to make room for everything to stay below this target. And so the good news is that a 75% global reduction in meat and dairy intake would save us 8 or 9 gigatons or so. And cutting food waste in half would save a bit more. And this is where we could be in a spot where we could realistically put all of our emissions below that emissions threshold. So this is echoed throughout the literature. This is a 2020 report that just came out in Science, essentially saying the same thing, that in order to stay below the greenhouse gas emissions target, we have to address the emissions from agriculture. And we have to do that in 3 ways. One is always a shift toward plant-rich diets. It doesn't mean vegan per se, but it does mean that the majority of what we're eating is plant-based. Secondly, we have to cut food waste. And third, there is a role for technological innovations like increasing agricultural yields and increasing efficiency. Again, throughout the literature, plant-based diets, food waste, and there's a role for technology. And then this is from the Eat Lancet Commission, some of the brightest minds in food systems work, again, identifying a healthy plant-rich diet as a key part of the puzzle in a sustainable food system future. And here at the Center for Livable Future, my colleagues and I are producing a growing body of literature, taking a closer look at what these dietary shifts might look like in practice and how they might vary by geography, because there are 2 geographic considerations that I'm going to talk about today that we have to be thinking about as we're designing the sustainable diet and the sustainable agriculture of the food future of our food system. So the first geographic consideration is that the greenhouse gas intensity of a given food varies based on where and how it is produced. So it's been well established, this is from our paper in 2019, that the greenhouse gas intensity of producing animal foods, shown on the right, is in most, not all, but in most cases, all else being equal, an order of magnitude greater than the greenhouse gas intensity of producing plant foods, shown on the left. And these data are per serving greenhouse gas footprints, but we'll see the same story, whether it's per serving, per calorie, or per gram of protein, or per unit of mass, or whatever. Now, there are some exceptions. There are some climate-friendly animal foods, particularly small fish like sardines and anchovies, and insects like crickets and mealworms. You'll note that these are animals that are low in the food chain. So we'll come back to that in a moment. But again, so, beef tends to be the elephant in the room when we talk about climate change and diets. I'm going to zoom in on the greenhouse gas profile of beef, and you'll note there's a pretty wide variation indicated here in the interquartile range. And so here, this shows us the y-axis is the greenhouse gas footprint of producing 1 kilogram of bovine meat by country, and the countries are shown on the x-axis. So all of this, it's the same quantity of beef that we're producing, but we're seeing tremendous geographic variation based on where and how it's produced. And that's because of differences in what the animals are fed, differences in how the manure is managed. Even the methane emissions coming off of manure will vary based on the temperature. We can also see for the 3 countries in the right, particularly Paraguay and Chile, large contributions from LUC, which stands for land use change, which in this context means deforestation. So in countries where there's a large amount of deforestation for grazing lands, that's going to ratchet up the greenhouse gas footprint. So in light of all these differences, when we do our research, we use trade patterns to examine, well, from where are you importing your beef or your pork or your poultry or whatever? Because there are very important geographic differences in the greenhouse gas profile based on how and where the food is produced. And again, just to come back to this, Paraguay, same amount of beef, was 17 times more greenhouse gas intensive than producing it in Denmark. But even in Denmark, it's still high. I don't want to say just because it's low over here that it's necessarily climate friendly. So overall, animal food's still far more greenhouse gas intensive than plant foods. But even within that, there are important variations. Another important question to consider is, and this is not reflected in much of the scientific literature, is the potential for well-managed grazing systems to capture, store, or sequester carbon that would otherwise contribute to climate change in the atmosphere. A well-managed grazing system, partly through the trampling action of the animals, can actually sequester or store that carbon in the soil, thus reducing the greenhouse gas intensity of grazing livestock. So if a study is ignoring carbon sequestration, then the intensive or CAFO or feedlot-based system would have a smaller greenhouse gas footprint because the animals reach slaughter weight faster and a number of other reasons. But when you do account for carbon sequestration, that kind of tips the scales, in many cases tips the scale in favor of the extensive system. Now, there's still a lot of unanswered questions about the potential for carbon sequestration in grazing systems, and that effect is it's finite insofar as you can only store so much carbon in soil. It's like a sponge. It can get soaked up to the point where it can't store anymore. So I think, I don't necessarily think that grazing systems can solve climate change. I think that tends to get overstated in some of the white papers and reports. But I do think we have to take this into consideration because that sequestration could make the difference that would tip the scales in favor of a grazing system. And we're going to come back to this at the end. So that was one geographic consideration, right? Where and how is that food produced? The other one that I want to talk about is that nutrition priorities, and by extension, what we consider a sustainable diet, vary by geography. So when we think of a sustainable diet, we often, what first comes to mind is, well, if it's sustainable, it must be good for the environment. We care about climate and water and air and so on and so forth. And yes, the ecological soundness of the diet is a key piece of what would be considered sustainable. But I really like the FAO's definition because they broaden sustainability to add that it must also be nutritionally viable, right? You can design the most climate-friendly dietary pattern in the world, but if your population is falling short on their B12 and iron requirements, and they're suffering from stunting as a result of protein deficiency, that's not a sustainable diet. It has to be nutritionally viable. It also has to be culturally appropriate. Maybe we shouldn't be off. Maybe Beyond Burgers aren't, a realistic or viable option in a country like Indonesia or Ethiopia. It has to be affordable, and the foods in the diet have to be physically accessible. So I'm going to touch on this theme again, but when we're thinking about the future of our food system, we can't just be thinking in silos in terms of, well, what's best for climate change and climate change only. We have to think broadly because these are all interconnected pieces of the same system. So with this broader definition of sustainability in mind, how could I forget? It also has to be fair and equitable, right? A food system that's sustainable for only half the population isn't really sustainable if we're leaving other people out of the picture. Okay, so this is some of our research. We measured the greenhouse gas profile of plant-forward diets, healthy plant-forward diets, specific to 150 countries. And these are our results for the United States, and we counted for trade patterns and country of origin and everything else we talked about. Since we don't have too much time, just to kind of draw your attention to the far left and the far right, the y-axis is the greenhouse gas intensity of the dietary pattern per capita per year. And the baseline is a close reflection of the current US food supply. And on the far right, we have the vegan diet, exclusively plant-based, and a low food chain diet, which was a dietary pattern that was mostly plant-based, with some protein from, you guessed it, remember we talked about low food chain animals before being climate friendly. So the low food chain diet does include animal feeds, but they're all low food chain animals like mealworms, crickets, anchovies, sardines, so on and so forth. So that's the low food chain diet. And what was surprising to us, so the Eat Lancet Commission has a target for greenhouse gas emissions in 2050 from the food system. We have to stay below this target to avoid the most catastrophic climate outcomes. And there are only 2 diets in the United States that were below this threshold. So again, it's emphasizing the urgency of moving toward plant-based diets. Now, big caveat here, we're looking at the United States right now. It's not easy for everyone, but relative to other countries, it's relatively easy for someone to follow a plant-based or mostly plant-based diet. Not everyone, but a large share of the population has access to a diversity of healthy plant-based options. Again, that's not true for everyone. Food insecurity is still an enormous issue in the United States, but compared to a low and middle income country, we have convenient options like the Beyond Burger and the Impossible Burger and Burger King. We have the option to supplement with B12, so on and so forth. And here we can see the US, as you're probably not surprised, is among the top 10 per capita meat consuming countries in the US. So the red countries consume more meat. Now you're about to see some interesting correlations between this map and this map. So this second map is where colleagues and I at the Center for Livable Future, we modeled the greenhouse gas impact of the planetary health diet, which is a healthy plant-rich diet from the Eat Lancet Commission. It's predominantly plant-based. And we wanted to see what was the percent change in food-related greenhouse gas emissions when countries shifted to this diet. So as you would expect for countries, OECD, high-income countries like the US, the UK, Europe, and Australia, when they adopted a healthy plant-rich diet, the greenhouse gas profile went down relative to what we're consuming right now. However, in much of the low and middle income countries of the world, like in sub-Saharan Africa, parts of Southeast Asia, those are populations where much of the population is falling short of nutrition requirements. So for them to adopt something that's healthy and actually meeting their nutrient requirements will in many cases actually require an increase in the intake of animal source foods. So regardless of climate impact, we can't deny that animal source foods are a good source of micronutrients, vitamins, and minerals. And it could be beneficial for particularly children in those countries to increase their share of animal source food. So we have this challenge where countries like the US have to go down, but we have to reduce enough to accommodate the fact that many low and middle income countries will actually need to increase their share of animal source food. So key take home message being here is that there's not a one size fits all solution for sustainable diets. And there's a lot that we have to take into consideration in these different geographic contexts. And I guess I'll close, just kind of to bring back what Daniel and Leah talked about. I mean, I was just talking about climate change, right? And again, we can't make these decisions purely based on climate change alone. Yes, there's some urgency to move toward plant-based diets, but this industrial food animal production system is a major driver of climate change. And regardless of whether it's more or less greenhouse gas intensive than the grazing systems, we also have to consider the impacts, like the generation and spread of antibiotic bacteria, novel viruses, impacts to air and water quality, occupational health impacts to rural communities. And I think when we take all of that into consideration together with the impact on climate change, it's pretty clear that we need to make some dramatic shifts in our food system. Yes, there is a role for animals and livestock in a sustainable food future, but it's likely going to have to look very different from this, and also going to be at much smaller quantities than what we're consuming now in countries like the United States. So with that, I will stop and thank you, and I look forward to your questions.
Thanks, Brent. That was great. And I'll just go ahead and ask you a question. And if anybody else has questions for Leah or Brent, please put them in the chat box or the question and answer box, and we'll get to those. So my question to you, Brent, is how do you see, and this may be something that's way beyond what you can answer, but how do you envision using GIS or using like mapping to be able to demonstrate those different diets that are needed in different areas? Because I think that would be a very powerful tool to message that, because I think people don't get that the one size fits all is not going to work.
Yeah, well, I think there's a dearth of good data, particularly in low and middle income countries, on the greenhouse gas intensity of different agricultural production systems. So I think there is an amazing opportunity there. I mean, this isn't directly related directly on diets, because we're looking at agricultural production, right? But in order to better understand the diets, we need to have better data on how these different foods are being produced in different geographic contexts. So I think there's an enormous opportunity there to get better data on production methods and the associated greenhouse gas emissions of different foods from different countries. Also, well, trade patterns are extremely tricky. So when most researchers do this work, they are really only looking at the agricultural phase of production, because if you start measuring something like food miles, it just becomes enormously complex. When you consider, where are the transportation hubs? Is it being supported by air? Is transported by air, land, or sea? Where are the truck routes going? So I think there's an opportunity there. Granted, I think food miles do get a lot of attention, but they are a smaller share of the greenhouse gas emissions relative to agriculture. But it's still a missing piece of the puzzle that we could better understand through GIS.
Yeah, no, I agree with you. And I think that also the inputs are much different in each country as to, what, like you said, is a culturally appropriate diet, what they have access to, and how that, they can be resilient and self-sufficient. And I think that that's also a big sort of missing piece to the puzzle. But I was thinking, it would be really interesting to be able to see that on a map and one of the things that was discussed in one of the previous sessions was that the time scale, and being able to see that moving over time to help understand, the gradual or quick changes in systems and things like that. So,
Oh, I'm sorry, go ahead.
No, you go.
I was just going to add, I mean, you made a great point too about the viability of these plant-based diets in different countries, and we can say, hey, it would be great if you adopted this plant-forward diet in country X. But another role for GIS is examining the potential for the agricultural land in that country to actually support that diet. You know, in the United States, at least last I checked, we are not even growing enough fruits and vegetables for the average all Americans to actually meet the dietary recommendations for fruits and vegetables. So there are changes that need to happen in how we use land. So that's another geospatial component to make sure that these diets are actually going to be viable based on what we're growing.
Yeah, no, that you're right. That is huge. And so I don't see any other questions. I know that Leah, are you still on? Excellent. Yeah, you're muted if you were gonna talk. So where do you see this going as far as the mapping that you're doing with the workers and COVID?
Sure. Well, you know, as I said, you know, in the next few months, I'll be on is how this sort of unprecedented scale of COVID transmission is affecting food system workers. And there's a big question on whether we'll even be able to monitor that. You know, I've been concerned about particularly the sort of quasi breakdown of contact tracing in a lot of places to try to establish, you know, a really firm connection between, you know, a facility that has an outbreak and a worker that got sick there. You know, one of the, you know, as I mentioned, trying to make the most conservative possible assessments. You know, if I don't know for sure that a case is linked to workplace outbreak, it's typically not included in my data set because you know, we want that link if we're asserting X number of workers have been sickened at work, you know, want that to be as accurate as possible. So already there was some shakiness where, you know, sometimes states would release data about, you know, workplace outbreaks, including they would lump in family members, they would lump in, you know, community spread from that plant into that cumulative total, and that sort of made that data not usable for my purposes. And you know, I'm personally concerned we'll see more of that, or, you know, sort of less accurate counts linked to specific facilities, just because we know public health authorities across the country are really struggling under the weight of, you know, so many cases and so much transmission at once. Another, you know, sort of next chapter we'll see that I just did a story on is about the allocation of a COVID vaccine to food system workers. There's states were required to start building out some plans for COVID vaccine distribution and submit that to the CDC in October. And what I learned from that was that a lot of states, and particularly states where there are high numbers of, you know, meatpacking workers, farm workers, you know, food system workers are high up in sort of the allocation phases. So we sort of have, you know, essential frontline medical workers and people in that community who are high risk, especially. And essential workers are sort of often in that, you know, late phase 1, early phase 2 allocation plan, and especially food system workers who have comorbidities or are of a more advanced age. So I did a story looking at what are some of the obstacles to accessing, you know, worker populations where not only is there, you know, sort of perpetual language barriers in a lot of places, you know, really wide range of languages spoken, but also a lot of trust has crumbled in the last 6 months as, you know, this population has been so dramatically impacted by the virus, and, you know, has had a really wide range of experiences with their employers' responsiveness and state health authorities' responsiveness to their concerns. And, you know, we know that federal OSHA has received a lot of criticism for not responding to as many worker complaints and so on. So there's a big trust gap there that I know that, you know, labor advocates and public health advocates are really focused on right now, so that when that vaccine is available and ready to be distributed, that there's some trust in place, and there's some pathways for food system workers to access it, and particularly those that are undocumented and that might be in even more you know, unstable or precarious positions. So I'll be watching that really closely.
Yeah, that sounds like a great thing, and it will be really valuable information. And thank you both so much. So anyway, so thank you so much for your presentations and for your attention, and thanks to our panelists. You know, again, the recording and others will be available after all our sessions are complete on the event landing session of our first, and thanks for being on with us. Again, thanks to our co-sponsors, the Center for a Livable Future and Spatial Science for Public Health Center. And if you're interested in learning more about either center, we will also drop the links in the chat box as well. So thanks and enjoy the rest of your day, everybody. Thank you so much. See ya.